video reflection for Athletic Training 363 Lab Ortho Upper Extremity. I'm going to talk about my SPs that we did in the class. I think overall they went okay. The little piece of paper on the door always gave me a little bit of tunnel vision, so I struggled with that. Just remembering that there are multiple pathologies with multiple signs and symptoms, so trying to look at the patient as a whole, not just what their symptoms say. Like with piriformis syndrome, numbness and tingling down one side of the leg, totally just didn't think about low back or sciatica or anything like that. I just went straight for piriformis muscle and tightness and evaluated that. In my past SPs, I've also noticed the tunnel vision. I think I struggle with being given the symptoms and what the patient is presenting with, because in a clinical setting, a patient walks up to you and starts talking to you about it, or you ask them questions, whereas in the SP, you walk in already knowing things like their name and their age, so sometimes I forget to ask their name. I think some strengths I have are probably taking a history, pretty good about at least covering most of my bases, so numbness and tingling, history, the MOI, if it affects their activities of daily living. So the history I think I do well, but then I get stuck, so if they have telltale signs of specific pathologies, I'll get tunnel vision and not be able to get out of that. And I think it's a lot different in the SP versus my clinical experience, because the SPs are very textbook, and you don't get a lot of textbook cases in a clinical setting. They walk up to you and they're like, it's pain's over here-ish, over somewhere, and so it's not as pinpointed. And I think if the SPs reflected that, I would actually do better because of the less textbookness. I'm sorry, lost track. So I think a weakness for me is getting tunnel vision in the SP, but in clinical setting, I think a weakness is just the confidence that I know what I'm doing. In the most recent SP, I got very flustered. I knew what it was before I finished taking the history, and then I need to do palpations, so I did those. Luckily, I remembered to do everything bilaterally, so I did palpations, and then after palpations, I did my range of motion, which I did hip range of motion. I didn't really look at back or even their gait, which could have helped or could have, at least ruled out other pathologies. And then manual muscle tests, I tested one muscle because it's the only muscle I could think of that could possibly be affected. And then I also did the internal rotation of the whole leg, which tightens the piriformis. So I think that one, I thought that was a special test, but apparently not, so there's that. And I did one special test because I couldn't remember any of them. Mine kind of went blank. I think I just got really overwhelmed and very caught up in the numbness and tingling of going down the leg that I didn't think about, anything else that could possibly be wrong or be affecting the body. So I think SP wise, I think I'm doing better. I remember my first one, I was so nervous that I don't even think I asked 5 history questions, didn't do single range of motion, a manual muscle test. So I definitely have improved because I at least touched on each segment. Definitely didn't do enough, which I think I do more of in clinical practice, just because there's there's not this time lingering in the back of my head, and it's just do the evaluation, talk to your patient, learn more about what they're doing. There's also a different amount of relationship with a patient in a clinical practice, at least how I've experienced it is a lot of, at least especially at Turkey Run, a lot of the athletes, I know them, I've met them before, I've talked to them before. There's a relationship that you can talk about while you're doing special tests, so they're not just sitting there kind of wondering what you're doing. I think next semester I'm going to continue to work on my confidence in general. I know a lot, I can do a lot, and I think I lack the confidence. I just need to be sure that I know that I know. Kind of sounds redundant, but going and actually doing things on real live patients is a lot different than practicing scenarios in the classroom. So I think that overall my my clinical experience has gone better than my SPs, because if I have a question, I can turn to my preceptor and clarify or ask the question. SPs are really stressful. It's your grade, so I think there's a whole nother level of stress. It's different than a clinical setting. Clinical setting is more or less like, can they do this? Will they be able to play? How long is their rehab going to take? All of this stuff. Whereas in the SP practical setting, it's very much, what grade are you going to get on this? Did you do everything? Did you do it bilaterally? Whatever. If you miss something in an evaluation, your patient comes back to you, or at least they should, and you can talk about it or assess that then. So I think those are things that I'm going to take into perspective, try not to get so tunnel visioned in SPs and practicals, and just use my knowledge to reassure myself and give myself confidence in the future.